Hi everybody, I'm so excited. We're at my friend Scott Pensavy's Orthopedic and Rehabilitation Center in Las Vegas, Nevada. I'm so excited to introduce you to Scott, Rehab 1000 and the PMT and the basic training for Rehab 1000. We call it Longevity's Rehab 101 training. Come on in, I'll introduce you to Scott. Scott's treating a patient right now. He's actually treating my son, who's top 10 in the country in junior tennis, and he's going to go turn professional soon. So let me introduce Scott. Come on in. Scott, I want to introduce you to the Longevity family.
How are you?
Scott Pensavy, everybody.
You're all set.
Awesome, thank you, Scott.
Okay, I'll see you.
Scott just treated my son, Evan Son. He's top 10 in the country in tennis, and is soon to turn professional. Evan, how'd it feel?
Felt great.
Awesome, awesome. We're here today at Scott's center here in Las Vegas, Nevada. Scott's going to show us about this wonderful product, Rehab 1000, that we're in pre-launch mode with, and the PMT. We call it the Pensavy Method tool. He's going to treat some of the people here and show us exactly what to do and what not to do. Scott?
Okay, sounds great. I think I'm going to try you first, right?
Okay, let's do it.
Over here. So you've been having problems with your right shoulder?
Yes,
wrist?
with my right shoulder, my wrist, and my elbow a little bit.
Okay, let's have you lay down here for me.
Henry, how long have you had these issues?
Many years, maybe over 5 years already.
And have you, what do you think has caused the injuries, and have you ever treated them before?
No, I have not treated them before, and just years of playing, my muscle tissue just feels really tight, and just the years of playing and not treating it caused the injury.
I say, and you're a tennis player as
Yes.
well.
With Henry, I'm sure he's a tennis player, he's going to have some discomfort here, and I can feel that he has a little bit of scar tissue here, and scar tissue causes dysfunction. And so what we're going to try to do is, with the PMT tool, we're going to get in here and we're going to move this along in circular manners and scrape the scar tissue, try to break it up. As we're doing that, we're increasing circulation, increasing lymphatic drainage, which helps things heal, helps get the blood going into that area. What we're trying to do is make the environment that this tissue is in a much more healthy environment for it to heal and become more functional.
You and I have talked about that a little bit, that we're opening up the highway, that internal highway in there that may be stopped up because of adhesions, because of scar tissue buildup over the years, and it's gone untreated.
Correct. And it just gets worse and worse, because when scar is laid down, it's not laid down in an organized manner. It's laid down in a very unorganized manner. It just doesn't, it's haphazard. And with this technique, what it does is it realigns that scar to become more functional. It breaks up the bad alignment and makes the new alignment much more flexible and easier to move. And when you get done with it, you'll start to feel more motion, less pain.
In the Rehab 101 training is to show regular people out there how to use the PMT, you know, what they can do to help themselves to self-treat and also to help other people as well. And it's exciting for me because I've seen you do this for over 2.5 years now. My son's personally come in here, you've treated myself, you treated my wife, you treated my mother-in-law, who's 94. And it's amazing what I've seen you do here, and you know, I want to commend you for the healing hands and for the Pensavy method that you've created. So what we want to do is go through the 6 major body parts that you and I discussed in this 101 training, and you know, let's just keep continuing. You know, tell people how could Henner self-treat himself in this particular areas.
It would be hard for him to...
How can he get his wife to treat himself as well?
It'd be a lot easier for an extremity like this. He could do it, but if he had a significant other to help him, especially with the wrist, it's a lot easier. And what that individual would do is first put about a dime size Rehab 1000 onto the tool and get in here, and what they're trying to find is just lightly move the tool back and forth, and you're trying to find almost like a restriction. The more you do it, the better you get with it. The tool is like a vibrator motion thing where you can actually feel the vibration of the tissue. And when you go over a piece of scar that's old or chronic, it'll kind of like feel rough and gritty. And if you feel that, then you just press down a little bit harder, and you'll see some redness start to show. That redness is the increase in circulation and the increase in friction that you're causing. Now with the Capacin and the MSM and the other products that are in the cream, that's going to help with the inflammation also, so it helps it heal. So not only is the technique appropriate, but so is the cream. Added, it's a benefit. So now we just work this.
I've heard like metabolic wastes get caught up, and if they're not broken up, they
Sure.
won't dissolve, and they'll build up in that area. Is that correct?
That's definitely correct. If you work out at soreness, at post-exercise soreness, that's lactic acid being built up. So that's that byproduct of something that's being worked out and destroyed. It's muscles breaking down. What leaves behind scar, and that's the pain that you feel discomfort. Mm-hmm. So we actually can use this blade and this technique pre and post exercise, not just for injuries. So we can use it for that too.
Awesome. You know, I initially met you because Evan was having so many problems with a recurring back issue and hip issue that wouldn't go away.
Right.
And so I'm so excited about the Rehab1000 system with the PMT and the Pennsylvania method application, you know, for world-class athletes, you know, like Evan. Boris Becker, you treated him the last couple of months, and he was really excited about the Rehab 1000 and the PMT.
Correct.
So I'm excited about that, but I'm more excited about the baby boomers out there. The number of baby boomers. I mean, we're getting older. We all got issues: knee issues, shoulder issues, back issues, neck pains, knee pains, etc. And most people are just not seeking out any type of physical therapy to get help and to get relief from pain. And so I've been in here for 2.5 years. I've seen you work with people, baby boomers, people in their 60s, 70s, 80s, my mother-in-law in her 90s, and the relief that people have gotten is just tremendous. You know, so you know, let's continue. Henner, how are you feeling?
Right now it feels actually good. I just feel a little blood flow going to that part, and it starts to loosen up.
Is it too hard?
No, it's not too hard.
Comfortable?
It's comfortable, yeah.
Okay.
Now, I think, Randy, you had asked some questions earlier about how hard you can actually go with the PMT.
How do you know how much pressure to put on?
Yeah.
Scraping.
Yeah, that's a good question. When you first start off, I always just do very lightly, so you're not even making an indentation into the skin. And as you get better at it and more aware of what this tool can do, you can get a little bit deeper and deeper. But you really don't want to cause deep bruising, or you're not scraping, you know, causing the skin to break. It's more of a light technique. How we can grade it, it would be if we do a 1, 2, and 3, 3, 4, 5, 5, 6, 7, and further on, we're going to have a course for people that are professionals, and we'll be showing some much more deeper techniques. But for right now, the lay person, you just 1 to 3 pressure. You know, 1 would be just lightly touched, 2 would be a little bit indentation of the skin, 3 would be a little bit more, and you just seeing a little bit of a blanch of the skin, and that's probably as deep as you want to go. And that's it, and just back and forth.
Now, Scott, where there are healthy areas, I mean, it seems like there's no redness, but in this area, particularly here, you see a lot of redness here. Is that what's going on there?
Yeah, the more there's scar and adhesions in the area, and more there's that pooling of the blood that's static, you got to get it out of there, and that's what's happening is you're increasing that circulation in that area. So I could do the same amount of pressure throughout this whole forearm, and there are going to be spots in this forearm that are going to be redder than others with the same amount of pressure, because those are the areas that are restricted, and those are the areas that need to be healing. And so that's a really good indication to know, okay, now I got to really work this area. So it's another way that a layperson can look at the arm and say, well, this looks pretty good here, but you look at this elbow here, it's pretty red, so we know that there's some stuff going on in here. So we're going to kind of go after this a little bit more.
So once you find the redness, you really want to concentrate on those areas.
That's correct, and also using the blade to feel the restrictions. So you can actually feel, as you get good at it, I mean, there's one right there, and see, you feel that?
Yeah, I feel that.
Kind of it's a little grindy or gritty feeling, and I would just work on that just a little bit.
Is there certain points of the tool, the Pennsylvania tool, that you use for different situations? The points, I see that there's a curvature. Can you kind of go into
when we
why
design
you use this?
when we design this, each part of it is used for a different part of the body that we thought was more comfortable. I use the hole here because you can grab it and have something to grip hold it. Because it does, I mean, it could slip out of your hand when it gets a little greasy. But I like this if I really want to get in and do some real specific spots. If I got a large area like a shoulder, I can use this here. This works really well. tendon, bicep tendon. I go in there like this. It's great for the fingers. I use that. So yeah, each one of these, and you can play around with it. You know, you can play around with it, and I can go through why I use each one of them. But those are some really quick.
So the different points and the beveled edge and so forth allows you to have different leverages to go into the muscle tissue and the joint areas and help reduce the scar tissue. And so sometimes we'll use the curvature and sometimes we'll use the point.
Correct.
Depending on the
Depending on what the outcome is that you're trying to achieve.
About how soon do people start to feel improvement right after they get treated?
Right away. You know, yeah, immediately. And if they don't, that's surprising. Usually it's right away.
So Scott, when people are treating themselves and this redness comes out, that's nothing to be worried about. This is natural.
Correct.
This is part of the process.
Correct. That's a urethemia reaction. It's just like if I sat here and I gave a deep tissue massage and rubbed and rubbed and rubbed, it would become red. And that's fine.
And then it'll go away.
That will go away. Sometimes when the area is very chronic and has a lot of scar tissue and you work on it, you might get some bruising. And that's something that we have to be aware of. You don't want to go that deep, but it does happen sometimes. And if you just got to back off, and then you give about 7 to 10 days to let that area heal. If you don't get the bruising, I mean, you can do it every 2 to 3 days, and you'll be fine.
Awesome, awesome. I talked to you a little bit about last week that I'm on the computer so much that I was experiencing what I thought was carpal tunnel. Talk to us a little about carpal tunnel and how people can treat themselves and the people that they know, their loved ones, their family, their friends, you know, people who are experiencing carpal tunnel because of overuse of the wrist area.
A carpal tunnel it's a diagnosis of the median nerve, which is a nerve that runs into your wrist here, and it gets trapped under a ligament called your transverse ligament and gets compressed by hypertrophy of the muscles below it being used, and then on top of it you got the tight band pushing on that nerve, and it gives you the numbness and tingling. And so what I do is I put a patient, we call supinate the patient all the way up like this, hold their thumb, and I'll get in here, I'll put a little bit of the Rehab1000 right on that wrist there, and I'll just hold his thumb out here, and I'll get in here, and there's a transverse ligament attaches and goes across here. It's like a bridge, okay, and underneath that is the nerve, and I would just work this, okay? Now, if it's acute and it's chronic, you might get some tingling and numbness in these fingers here. Just go a little bit lighter then so they don't feel that, and just bring in here and work it up here. At the same time, keeping a nice stretch. And I would just keep working on that. And also, whenever you're treating down here, you always look proximal. We found that C5, C6, and C6, C7 up in the neck, which is a neck bone, that's mostly involved with this too. So I would go up and work on Henner's neck at the same time, because that nerve comes out of here, goes all the way down here, comes down underneath here into the fingers.
I see.
So I would trace that all the way up.
So someone suffering from carpal tunnel or something like carpal tunnel, how many times a day could they treat, and then how many times a week and a month?
The PMT tool used 2 to 3 times a week. The Rehab1000 can be put on 2 to 3 times a day. Okay, so you don't need the tool to put the Rehab1000.
So they can be used separately then?
Correct.
You can use the Rehab1000, apply it and use it with the PMT, and then you can use the Rehab1000 just by itself with a little simple massage?
Correct.